Are we there yet? And the answer is absolutely not. We're not there yet. But does that mean that we get discouraged? No, it doesn't mean that we get discouraged. It just means that we stay smart and we strategize. Where we are we there yet? And the answer is absolutely not. We're not there yet. But does that mean that we get discouraged? No, it doesn't mean that we get discouraged. It just means that we stay smart and we strategize. So I know that we see this. I know that we are numb to this many times, but we are not there yet. We are still at a rate of death that is higher than we were at this time last year. And so we have to keep that in mind. And one of the things I just want to encourage us to do is to not get dissuaded by the media, by people who are pushing to open things up, because we know who the most vulnerable are. They're our friends and family. They live in my house. My mother is 65. She has diabetes, high blood pressure, autoimmune diseases. And my son is 16 years old and he is immunosuppressed. 17. He's on an immunosuppressant medication, and that's $1,500 a shot. Thank God we have insurance. But even if he gets the vaccine, if he with the current vaccine that we have, it's not going to be effective in fully protecting him because his immune system may not be able to build up the antibodies that it needs. And so one of the things I just want us to keep in mind is that we still have vulnerable people. Therefore, we still have to take measures to protect them. And I'd really like to encourage us to shift our mindset from, when can we get back to doing things that, we want to do, to how can we continue to protect those who are most at risk. And so I just want to show you here, you guys can see this death rate. And this is showing you that we still, in the Black and Latino communities, have the highest rates of death. And that's for multiple reasons. Oftentimes it's also due to lack of access to critical medical care. A lot of folks are told to stay home, and a lot of folks are sent home from the hospital. Now let's talk about vaccinations. One thing that I want to let you know is that after the Johnson & Johnson pause, we've had a considerable decrease in vaccine uptake or people wanting vaccines. Most sites have shifted to the Pfizer or Moderna, or they've started to offer Johnson & Johnson again. However, people are still not wanting that vaccine. And I do appreciate the statement that was made earlier about not calling it hesitancy and really, calling it a concern. And, what I've told folks is that it's a valid concern. The other thing that I tell folks is that Black and Latino people have never been anti-vaxxers. What's happened is that there's been a mix-up between historical mistrust. People reference Tuskegee. However, that is in relation to participating in clinical trials. And that sort of got mixed in with the vaccine efforts or the vaccines. And so I just wanted to make that clear. I know that you guys all know it. However, I think if we could, again, use our collective voice to, when we're speaking, when we're talking to our friends and family, to our communities that we're working with, just let them know, yeah, it's okay to be concerned. Yes, it's okay to ask questions. And, I've done this with other groups. I'm more than willing to sit down and talk to folks and show you the science in a non-biased way, let you know in a very transparent way, like what we know and what we don't know, and how do we move forward in this process. So I just wanted to now go back to vaccinations. So over 7.8 for or total doses in Los Angeles County. This does include the different sites, whether they are run by private hospitals, whether they're run by LA City, LA County, or other government organizations. Okay, so these are seniors, those 16 and older, but what I really want us to focus on is this map. And this map is, what do we see? We see SPA 6, right? And that orange part is a little less than 45-30%, uptake in the vaccine. So this is the area, these are the areas that we are working with. And we are trying to get vaccines for. And when I say I'm frustrated, I just mean that there's absolutely no reason why we cannot set up more vaccine sites. Again, it's not an issue of hesitancy, it's an issue of access. So then let me just go to the site here. So if you wonder, well, why aren't, why does it look like that? Well, what do you see with the sites? We see the same area with no sites, right? Or very few sites. So again, don't blame the people. Don't blame the people who are living in those areas for not getting vaccinated when you know that they take the bus, when you know that people walk places, when you know that they're not going to drive to Dodger Stadium. They're not going to drive to these big places and spend, 3 hours in line. Furthermore, they're not going to sit on their computer at, 6 in the morning and try to log on to get a site. I mean, after doing it 1 or 2 times, people are going to feel frustrated and just say, well, obviously you don't want me to get vaccinated. In our efforts, we really did help individuals, or say it this way, we didn't feel bad for turning away people at the vaccine sites who were not from SPA 6, SPA 8 in the targeted zip codes, because we knew that folks were coming in and taking spots from other individuals because they had access to the online system. And so when we were at Jesse Owens Park providing vaccines there with FEMA, Cal OES, and Community Coalition, was 4,500 people vaccinated in a 2-week period. 95% of those people came back to receive their second dose. That's higher than any other site in the county. And then for what we're seeing now, however, again, because of Johnson & Johnson pause, we are not seeing the numbers that we were seeing before. And this is countrywide. So then how do we address this and what do we do? Well, one of the things is that we are still working to get more vaccine sites in these areas. So how can we do that? Yes, public health is limited. However, we do have an amazing physician, Dr. Jerry Abraham, that has been working with us in a number of groups to bring vaccines to places. What are we limited by? We're limited by people and resources. Resources are not that much. We're just asking to feed volunteers. We're asking to, help provide maybe a gift card for volunteers. And because most of the people who are coming out live in the community, and then they're taking time away from something else that they could be doing. And so, we want to make sure that, how do I say this? Oh, I'll just say it. It's not fair that Blue Cross gets $15 million to construct a system for signing people up for vaccines when they're not effective, and we're effective, and we get very little. You know what I mean? Or we're barely getting anything right now. And when we're saying it's really just for logistic purposes. being able to pay for lunches, water, snacks, gas for our trucks. We're not asking for a lot. We know how to work with little. Many of us have worked in developing countries, and so we know how to get things done efficiently. So those are our real limitations. And so if we had the people, if we had the resources, then we could do a lot more. But we can't ask people to volunteer from 5 p.m. to 12 a.m. at a vaccine site. That's just not appropriate, and we have to be able to, again, provide funding for those individuals. So if you guys want, I send out usually a email when we have a new vaccine site that comes up, and there are different sites. A lot of the sites that Dr. Veal and Dr. Vargas are working with, the churches, and there's particular to those churches. We're working to have access or open access to anyone in the community who wants to come and get vaccinated on certain days. We're trying to make this happen 7 days a week. We're trying to make this happen, in later hours as well, because we know that the 8 to 5 time period is not, it doesn't work for people who are working those hours. And so our next sites, May 15th, we're looking at different sites in Compton. There really has not been vaccinations provided on the ground or a set site provided by DPH or anyone else. So we are looking at a couple of different places, the Gateway Plaza, Ludus Park, and then we would love to partner with folks to get the word out. I did talk to some folks who live there who were, just there at one of the parks, and they just said, no one's been out here to talk to us. No one's, come and told us about these vaccines. And, so I think that, again, the issue is not hesitancy. The issue is access. And so that's what we really have to push our federal and state and local politicians to help us with. I don't know how much time. I think I had just 15 minutes, right? And then one of the last things I wanted to encourage everyone is that we must continue to wear masks. And I'm going to go to another screen. And I just want to explain really quickly a little bit of the pathophysiology of the virus. So what is its structure? What are the vaccines? What are they effective against? So this is the virus. You guys have all seen this. This is a spike protein. This is what the virus is made against. The vaccine is made against. The mRNA vaccines produce this, and your body will see this on a cell and target that cell to be killed. And also you will make long or short-term antibodies against this spike protein. The other thing that you see, before I go into a little bit more detail about the spike protein, is that there's different parts of the virus. We also have our nucleocapsid, that's here. We have our membrane. We have our envelope here, and then single-stranded RNA. And essentially, these are other, except for the single-stranded RNA, these are other targets for possible antibodies. So I just wanted you to know that. So what about the variants? The variants occur because of changes in this S1 portion of the spike protein. So there's an S1 portion and S2. So let me go over here. This is just another image of this S1 and S2 protein. And I'm going to give you another image that shows you what is S1 portion and what is the S2 portion. The S2 portion is conserved among the different strains of the virus in general. it's more conserved than this portion. So it is this portion of the spike protein that changes, and this is what causes the variants. So if you see where it is here, this is actually really smart for the virus, right? Because what is the goal of the virus? The goal of the virus is to invade host, to multiply, and to go on to another host. So you have to understand, how does a virus want to act in general? So what we know is that with coronaviruses in general, and then with SARS as well, this will change very frequently. So what we know is that if you have an antibody towards this portion, it's not going to be as effective. There will be some antibody to the S2 portion, and that's why, you know, we don't have all of the data yet, but what is being said is that it protects against hospitalization and death, but really it's only if you have a antibody that's effective against the variant of this spike S1 protein, and possibly if you don't have it against this S1 portion, that you have it against the S2 portion. So I know that that was a lot, but I hope it's clear. I hope that the image is clear.
Yes, that was great. Thank you, Dr. Sheila. That's very informative. Wow. Really appreciate.
That's why we have to continue to wear a mask. And so
yes.
We said that you don't have to wear a mask when you're out in public. That's for people who are walking their dogs around their house and they don't have folks who are around them. If you're in a swap meet, if you're in a factory, like even outdoors, you know, it's, you have to consider, you know, how close you're going to be to people. You know, if you're standing in a park 100 feet away from people, yeah, I'm sure you're fine. But it still takes about 10 to 15 minutes for UV rays, which they do, to kill the virus. UV rays also kill HIV, so we know this. So I just wanted to explain that to you and encourage you. I know that there's a lot of information that's coming out from the CDC, but I do want to encourage you to really come back to us before making changes. Many folks, many physicians, folks in public health, we have internal discussions, and we just say that this isn't appropriate guidance. We don't know who's writing this. We don't know if it's for political reasons. We don't know if it's for economic reasons. But we know that for health reasons, it's not the best guidance. So thank you. Hope I didn't take up too much of your time. And please feel free to email with questions. I'm happy to set up times to meet with folks in groups to talk as well.